with that, let me show you a chart. This right here is the chart of the percentage of the state of Massachusetts budget that is now going to Medicaid, I'm sorry. It used to be 24%. Now it's 44%. And one of the authors from MIT, an economist, of the state's healthcare reform plan said the state has no idea what's driving the growth in healthcare costs. We don't know the answer. We don't know how to fix it now. And the reason I bring that up is because I don't think this is a good model for strategic planning. I think this is a better model. And that's exactly what's happening in Massachusetts right now. They had a healthcare reform plan. It was put in place. More people are now covered. Costs are out of control. And there is legislation now at the state level to basically dictate hospital and physician rates. So when I think about health strategy, I think about it a little differently. I think about asking two questions. One, what are the big bets that we may need to make today in order to be successful in the future? And what are some small bets that we should probably make, kind of like an R&D project? So the big bets are based on return on investment. I heard of medical home earlier. Has anyone done a return on investment calculation on medical homes? How about population health? How about bundled payments? How about ACOs? We don't even know if those things work. Those aren't strategies. Those are R&D efforts at this point in time. And so what I want to do is refocus your attention on what are the key strategies that we need to be focusing on today to make our organizations better and better adapted for the future. Which reminds me of two companies. One is doing pretty well, the other one not so much. Apple, by the way, remember the roller coaster ride? Steve Jobs and Wozniak did Apple and everything went fine, and then they fired Jobs, right? And then when he came back to Apple, he made the following decisions. He said, we're going to look to invent the next big digital thing. They render their products obsolete. So if you own an iPod, keep it, because they're not going to be making them in the future. They don't need them anymore. They're replacing them with the iPhones. They created easy-to-use, reliable, disruptive products. They expand beyond traditional boundaries. Kodak, by the way, had you invested in Apple stock, which I did not, your return on investment over 25 years would have been 6,000%. Much of that during recent years, during the most difficult economic times since the Great Depression. Kodak, on the other hand, was hooked on film. They were hooked on film. They made it for 50 cents. They sold it to us for $3.50. They charged us another $3 to develop it. So as the data came in about digital cameras, they filtered it. No one's going to want to buy a digital camera. They're going to want to hold film, the pictures, in their hand. Until about 7 years ago, they were putting on seminars trying to convince people that film was better than digital camera. They recognized that we were moving to a digital age. They actually created a system whereby you could get a digital picture and a film picture at the same time. Nobody bought it. And they were obsessed with cannibalization. They were worried about what happens if we start building these digital cameras, what's going to happen to film. So they were waiting for a signal from the universe to tell them what's the exact moment to turn the switch off from film and move it to digital cameras. But if you really want to assess your organization on whether you're kind of an Apple-oriented or a Kodak-oriented organization, the question is, look at your department managers and look at your physicians and ask the question, are they walking around the hospital trying to invent the next great thing? Or are they walking around the hospital trying to figure out how to preserve what we've been doing in the past? Because that's basically what Kodak did. By the way, I just want to remind you that one of the concepts of innovation here is that some things, that's why we do R&D. Some stuff doesn't always work. And as a result, had you invested in Next Computer, Jobs' new computer system program or company after he left Apple, you would have lost most of your money. So we have to learn how to fail quickly and move on. That's part of innovation. So there it is, the first digital camera. It was invented by this gentleman I guess on your left. His name was Steve Sasson. He was, in 1975, he was an employee of Kodak. For those of you who don't know, Kodak invented the digital camera. This guy invented it. And the guy came to a meeting just like this, And he showed the digital camera, and that's his son, and it's black and white, and you had to have all these devices, and it was bulky, and it was clunky, and everybody sat there with this bias saying, first of all, that's never going to happen. Nobody's going to want to buy it. And they all came up with reasons why it wasn't going to work. And the rest is basically history. So what we need to focus on is what's strategy. What's the right strategy for your organization, whether you're a smallish rural hospital or a large medical center? Where should you be investing your money, right, and your time and your resources today? And there's a great book called Good Strategy, Bad Strategy. It came out in January, where the author really defines strategy. Rummel defines it really well. He says, bad strategy are lofty goals, high hopes, and unrealistic ambitions. Every place I go, everybody's talking about managing population health. Really? You're really going to compete with McDonald's? Burger King, by the way, I saw 3 times during one television show. They now have you can call them up, it's Pizza Hut, and get a full dinner. It's a box, nice square box, and you get a pizza, breadsticks, and cinnamon sticks for dessert. And they're spending millions and millions a day marketing that stuff. And we're going to compete with that? Long on gibberish, short on specifics, strategic objectives that fail to address the critical issues. And that's really my job, is I want to talk about what are the critical issues. It's a budget or a long list of things to do. So what is strategy? Strategy is careful definition of the essential competencies you need to be successful in the future. And that's not going to be determined by you. That's going to be determined by your biggest customer, which happens to be the federal and state government. Don Berwick and his team have set the agenda for strategy. And that's this whole value stuff. That means you got to do more, and we're going to pay you less. Then we have to go to our local markets and honestly identify what are the challenges to our being successful in this new environment, and develop specific actions to overcome those challenges. That's what strategy is all about. Your strategic plan shouldn't be more than 5 or 10 pages, saying here are the competencies we have to have, here's the local problems we have, being good at those competencies, and here's how we're going to get better. And ultimately, strategy makes an organization sustainably differently better as measured by market share and profitability. You have a good strategic plan if your market share is growing and your profits are growing. And it's a bad strategy if both of those things aren't happening. Anybody can give business away and grow market share. The trick is, how do we attract business and make money at the same time? And by the way, Apple's been very successful at that for years. Now, Dr. Nash alluded to this, but I just want to bring it really home. Everyone take off your hospital and your physician hats and recognize this. If you make $80,000 a year, $80,000 a year, you're spending $18,000 on health care for your family, the poor, and the elderly. If you make $250,000 a year, you're spending $34,000 a year on your health care for your family, the poor, and the elderly. Think about that for a second. Next to your mortgage, the biggest annual expense that you have is health care. And the question that you need to ask is the same question the government and Blue Cross is asking is, okay, so what am I getting for this big investment? It's a bigger investment than your car. And the answer is, and Dr. Nash mentioned this earlier, we have a healthcare system that's 2 to 3 times more expensive than most other healthcare systems in the nation. A healthcare system that doesn't buy drugs in bulk, and as a result, unlike Canada, United Kingdom, and France, for $1's worth of pharmaceutical supplies, we pay $1, the United Kingdom pays about 50 cents. It happens to be a healthcare system where our physicians, as represented in this particular case by orthopedic surgeons, make somewhere between 1/3 and twice as much as their peers in other parts of the world. And the thing that this is for total knee replacement, this is just the professional fee of $1,600. It doesn't include the fact that the orthopedic surgeon owns the physical therapy, the MRI, and the surgery center where the procedure is performed. Now, again, I'm not saying that that's a good or bad thing. In fact, that's my business to try to help doctors and hospitals make more money. But that's what I'm paying for in a healthcare system. And in terms of quality, I'm not going to beat that. Dr. Nash talked about that, so I think he covered it. See, the problem in our healthcare system, to be blunt, is that everybody in our healthcare system makes more than everybody in everybody else's healthcare system. And it's not just the doctors. It's the consultants, it's the lawyers, it's the hospital administrators, it's the nurses, it's the pharmacists, it's the physical therapists. Just take a look at this is the amount of money we spend as a nation on average per discharge. 3 times as much as the average for other industrialized countries. And that's the problem. That's the real problem.